You're watching Arkansas Style on KARK.
In today's segment, we are going to be talking about type 2 diabetes. It affects millions of Americans and many here in Arkansas. I am joined by Dr. Keith Currie to discuss. Dr. Currie, great to see you.
You as well, Nicole. Thank you.
Before we get into the real heart of the matter here, can you tell folks at home a little bit about what makes you so uniquely suited to talk about this topic and help offer hope?
Well, I'm a board-certified chiropractic internist. I'm also a certified nutritional pathology and functional medicine practitioner. I'm an avid learner. I've invested a lot of postdoctorate financial resources towards my education. I'm going into my 22nd year of practice, and I've never worked harder, and I'm enjoying the fire out of it.
Love it. Well, you definitely know your stuff. I always enjoy our conversations. So today, type 2 diabetes. Why are so many people struggling with this?
Well, a lot of people say, well, it's lifestyle, or a lot of people say it's genetics, right? And they're like, well, my mom had it, my dad had it, my sisters, my cousins, my brothers, my grandma, my grandpa had it. So it's got to be a genetic thing. And sometimes their doctors tell them that. But there's an emerging field, Nicole, called epigenetics. And it's really come to light as of late. And epigenetics tells us that we don't have to be handcuffed or shackled by our genetics. Epigenetics says that our genes will express good or bad things based on the environment that we put them in. And so really, it's really come to the forefront now that a lot of clinicians and doctors have recognized that type 2 diabetes is a lifestyle disease. And a lot of times it's a choice that someone makes, which kind of sounds hard because we're not used to hearing those kinds of things. But the reality of it is so much of this can be controlled.
Okay, and this is why we are talking about it, Dr. Currie, because there are several complications related to type 2 diabetes. Touch on those.
Yeah, this is where it gets very serious, Nicole. 66% of type 2 diabetics leave this planet Earth because of the complications of cardiovascular disease. That's actually listed as the cause of death. So this is a big deal. Type 2 diabetics are more likely to develop dementia than a non-diabetic because of the high blood sugar and inflammation and damage to the brain that causes. They also face a much higher risk for cardiovascular disease in general, such as high blood pressure, strokes, and heart attacks, because the diabetes causes systemic vasculitis, which is widespread inflammation of blood vessels from head to toe. And that's why heart attacks and strokes are so common in diabetics.
Okay, you talk about specifically neuropathy as maybe being a warning sign. First of all, can you briefly tell me what neuropathy is and why it might be something to pay attention to?
Yes, ma'am. I always say that neuropathy for a diabetic is often the body's first warning shot. In my spine care practice, I work with a lot of patients who have what's called compressive radicular neuropathy from spinal stenosis and degenerative disc disease in their spine, where they'll have tingling or numbness or burning in their hands or their feet, abnormal sensations, and it's very common in the spine care practice where they could have pressure on nerves in their neck or low back from degenerative disc disease, spinal stenosis, and arthritis. In my functional medicine practice, I see a lot of diabetics and pre-diabetics, and many of them are suffering from earlier stages or even deep stages of neuropathy. And in those cases, it's the chronic high levels of blood sugar that's depleting nerves of oxygen. And when those nerves begin to die, you see pain, burning, numbness in the hands and the feet. And once circulation is impaired, Nicole, the tissues in those areas can start to die. And that's why amputations and blindness are tragically common in advanced diabetes.
Whew. Okay, you've got my attention on that for sure. But you have given us some hope. You've developed something called the Back to You method. How does this make a difference?
Yes, ma'am. I've been doing functional medicine for a lot of years. And then, my Back to You method is my proprietary protocol that I've developed over that period of time. And it's built on advanced testing and nutritional pathology. And first of all, I tell everybody, I don't treat diabetes. I think it's very important to understand that. And I explain that to all of my patients. Instead, I look for hidden sources of inflammation, nutrient deficiencies, gut imbalances, toxic loads such as heavy metals or mycotoxins or other environmental pollutants and contaminants, and things that are the underlying drivers of insulin resistance, because that's what diabetes is. It's severe end-stage insulin resistance. And then I create a specific individualized protocol that helps restore balance and function to the patient's body. And that's the power of the Back to You method and functional medicine in general, because it's unique to each person.
Okay, well, when we talk about the power of this, what kinds of results are people experiencing?
Oh, I've seen wonderful things happen with so many patients over the years. Oftentimes, patients lose weight, their energy returns, their blood sugar stabilizes, and some reduce or eliminate their need for medications. And most importantly, they regain control of their future, reducing the risk of dementia and heart disease, neuropathy, and amputations.
Well, and just like today, talking to us about type 2 diabetes and you're experiencing with this, you've also developed a free resource. Let's invite people to check that out.
Yes, I offer a free report called Are You Toxic? The Silent Sabotage, Hidden Toxins Could Be Making You Sick, and explains how my Back to You functional medicine protocol is laid out in detail and how it can help people with chronic conditions. It's a $27 value and it's completely free. All they have to go is to go to the website, Are You Toxic, S-I-C-K, T-O-X-S-I-C-K, areyoutoxic.net, and they can get that report.
Dr. Currie, I always enjoy our conversations because you do give us so much hope. Thank you for the time.
Thank you, Nicole.
If you are experiencing type 2 diabetes, be sure to check out Dr. Currie. We'll be right back after this. You're watching Arkansas Style.